Welcome to Lecto. Today we are going to discuss positions of the uterus, different parts of the uterus and the measure of the uterus. So let's start. First of all, we will discuss the positions of the uterus. So actually, uterus consists of three major components. First one is the body, or you can say corpus. Second one is the isthmus, and third one is the cervix. So these are basically the three parts of the uterus. So in that situation, now we have to decide the positions of the uterus in the female body. So first of all, here you can see this is the vagina. This is the vagina. Now, above the vagina, you will see the uterus. So, in that situation, you see, here is the situation. This one is the cervix, and last portion is the uterus body. So this is the situation. In that situation, first is the vagina, second is the cervix, and third is the body of the uterus. So first of all, if you see here that the plane of the vagina is actually, you can say this is actually the axis of vagina. Number one, this is the one axis. Second is the axis for the cervix. So here if you see that this is the axis of the cervix, this portion is the axis of cervix, and last axis is the this one. This is for the axis of the uterus body. This is axis of the uterus body. So these are basically the three axes. In that situation, we will discuss two positions. First one is the Ante-version, and second one is the Ante-flexion. So if we notice the term, anti mean forward, anti mean forward. So if you focus on the words, then you can easily understand what actually mean by Ante-version and Ante-flexion. Anti means forward, or you can say before, and version mean actually the tilting, or you can say bending. This is the bending, okay. And flexion mean, this is actually also the bending, but in flexion we say that the bending is towards the organ. So this is the situation. Like if you see here are basically the organ, and this is the part of this organ. If I say that if the bending is towards the organ, then I say that it is the flexion. But when the movement is away from the organ, then we call it extension. So this is the case. Now it's something bending towards the organ, but that bending is forward. So this is the situation. So we see here. First of all, this is the axis of the vagina, this is the axis of the cervix. Now, these two axes form an angle. So, in that situation, this angle is actually from the 90 degree. So, this is the situation. And now, you see vagina, and after the vagina, you will see this cervix is bent forward and tilting. forward and tilt. So this is actually called the ante-version. So on the basis of this, the angle that is formed between them is called the angle ante-version angle. So this is the situation in which you will see the angle is 90 degree. So this is the case. Next, if we see that the axis of body and the axis of the cervix, you will see another angle. Now the bending is from the cervix. At the cervix you will see the further bending, but it in front side. So in that situation it is called the ante-flexion, and it actually bend towards itself. So that's why we call this flexion. So it is actually called the ante-flexion, and the angle formed between them is actually 120 degree, and that angle is called the angle of ante-flexion. So these are basically the two situations. And if we see that in normal situation, the uterus move at the right side. So we see the two terms, dextro rotation, and second one is the levo rotation. So these are basically the two terms, dextro rotation and levo rotation. Dextro rotation, dextro means right and levo mean left. And if we see that the uterus show the dextro rotation, what type of rotation? Dextro. This movement is shown by the uterus body. I'm talking about body. And levo rotation is shown by the cervix. So here is the situation. If you see that the white portion is the body of the uterus and the green portion is the cervix. So here is the position, that is front side. If the body of the cervix move right side, this is the right side, this is the left side. If the body move right side, then the automatically this is the movement of the body towards the right side. Automatically the back side, which is the cervix, move left side. So that's why we say that the body of the cervix show the dextro rotation and the cervix show the levo rotation. So this is normal, and dependent till they show this position. Okay, now we clear the concept dextro rotation and levo rotation. And if we see, as you know, that at the front side of the reproductive system we see the urinary bladder, and at the back side we see the rectum. Rectum is actually present at the back side. So during pregnancy, when the uterus is in full bloom, or you can say in full dilation, then the uterus actually compress the urinary bladder, and due to the compression of the urinary bladder, the urine that is stored in the urinary bladder will release automatically. So in that situation, during pregnancy, female face such type of problem like automatic urination. So this is the problem. Next is the parts of the uterus. Actually, uterus has three parts. So first one is the corpus, or you can say body. This is the one part. Second part is the isthmus. And third part is the cervix. Cervix, lot of people think that the cervix is actually the separate part. This is wrong. We include the cervix in the uterus. So this is the case. Now, we discuss the corpus body. So in that situation, we divide the body into further two parts. First one is the fundus, and second one is the proper body. So if you see here, like in that situation, at the starting point you will see, and in that situation here is the case. Here from the this portion is actually the, it's actually called the body. This is actually the first part of the uterus, and that is called the body. In that situation we further divide it into fundus and proper body, and if we see here that the first portion here, this one, the first portion is actually called the fundus. This is the protruding parts of the uterus is actually called the fundus, and after that you will see this portion is actually the proper body. Proper body, and it actually the triangular in shape. So this is the first portion, and in that situation the important thing you have to remember, fundus has no cavity. There is no cavity in the fundus, and it is full of muscles. Okay, and proper body has cavity, and this is actually triangular in shape. And in that situation, if you see, this is the fundus, this is the proper body, and you will see both fundus and proper body form a junction. So this is the situation, and this junction is actually called, they not meet but they form a junction, and in that situation this junction like structure is actually called the cornu of uterus. Cornu of uterus. This is the case, and this point is very much important. You will see from the cornu of uterus, you will see the different structures attached to it. So one structure, if you see that this is the fallopian tube. Fallopian tube is actually attached to the cornu of uterus. This is the one structure, and you will see the ligaments are so attached to these parts. If I say the round ligament also attached to this part of the uterus, which is the cornu of uterus. So this is the case, and if we see the length of the body, and the length of the body is actually the 5 centimeter. This is the case. Okay, so next portion is the isthmus. Isthmus is actually a portion that is just after the body of the uterus. So this portion is actually called the isthmus. So in that situation you will see the opening, or you can say cavity constrict, and this portion, first portion, this one, the first portion is actually called the anatomical internal os. Os mean, actually this os mean ostium, and ostium means opening. So ostium actually mean opening, and you can also say that the another name for the ostium is actually the orifice. This is another name for the ostium. So this is called the first opening after the body is actually called the anatomical internal ostium. This is the case one, and after that you will see another ostium, and this ostium is actually called the, this one, this is actually called the histological internal os. This is the histological internal os. So the area that is present between the anatomical internal os and the histological internal os is actually called the isthmus, and it is actually 0.5 centimeter in length. So this is the case. Then what is different actually between the anatomical internal and histological internal os? So actually anatomical is actually the real constriction, starting of the constriction of the uterus. So this is the case. Now if we see in the next part, that is the cervix. In the cervix we see the columnar epithelium. So actually if we see the third part, so actually third part is actually the cervix. So in the cervix we see the columnar epithelium present in the cervix. So and in the body of the uterus we see the endometrium. Endometrium is actually present in the body. So actually in the isthmus we see the columnar epithelium is transforming, or you can say changing into the endometrium. So this is the situation. So it is actually the transforming phase from the columnar epithelium. So that's why we call this area is the isthmus, and first is the anatomical internal os, and second internal os is actually the histological internal os. So this is the situation. So in the isthmus we notice two important things. First, anatomical internal os, and second is the histological internal os. So these are basically. Next is the cervix, and cervix has two parts. So if we see that after the cervix we see the vagina. So we divide the cervix into two parts. So here is the case. The portion of the cervix that is present in the parts of the vagina, that is called vaginal part of the cervix. And that part of the cervix that is not present in the vagina is called the supravaginal part of the cervix. It means the part of the cervix that is not present in the cervix and that is present above the cervix. So this is called the supravaginal part. So actually you see the cervix has two parts. So here we divide the cervix into two. Supravaginal part. This is actually the part of the cervix. Don't get confused with the word vagina. So second is the vaginal part of the cervix. So this is the situation. Because we know that the cervix is protrude into the vagina and some portion lie in the vagina. So this is the case. If we see that vaginal part we see in the nulliparous and the parous women. Nulliparous mean those women who do not get any pregnancy, and parous mean who get pregnancy. Okay, in the nulliparous we see that in the vaginal part. So this is actually the vaginal part of the cervix. This portion is actually the vaginal part. And in the vaginal part, in the nulliparous, you will see the conical shape. The shape of the vaginal part of the cervix is conical in the nulliparous. And in the parous woman, you will see the shape become cylindrical in the parous woman. This is the case. So, and most important thing, the last opening of the cervix is actually called the external os. So this ostium, or you can say orifice, external ostium. These are basically the two internal. One is anatomical and one is histological. And last portion at the ending of the cervix is actually the external os. So this is the case. If we talk about the shape of the external os, so here you can see in the nulliparous, you will see this is the external os, and in that situation the opening is cylindrical. But in the Paris woman we see that due to the ruptures of the muscles that is surrounded by the cervix, in that situation during the delivery the muscles rupture in the cervix. So in that situation the external ostium change shape and it will become slit like. So in that situation in the Paris the shape become slit like, and it in the nulliparous you will see the circular shape. So these are basically the two different shapes of the external orifice, and the length of the cervix is actually the 2.5 centimeter. So this is the case. Now the total length of the cervix will be 8 centimeter. Total length will be the 8 centimeter. How? 5 centimeter. Okay. 5 and 2. 7. 0.5, 0.5, 8. So total will be the 8 centimeter. And if we talk about the width will be 5 centimeter, and that width is from the fundus side. This is the case. Now this is the situation. If we talk about the thickness, then thickness will be 1.25 centimeter. Thickness of the uterus. And last, if we talk about the weight is actually the 50 gram, and this weight vary like 50 or you can say 60 gram, vary woman to woman. So this is all about the uterus. If you have any question, then you may ask in the comment section. Thank you so much.